to be doing a laparoscopic nephrectomy on a pig for a project, and this gives us a prime opportunity to utilize the laparoscopic HSI camera to be able to look at the kidney and its oxygenation state. What we have found in some experiments using the open version of this camera in the human OR is that being able to detect the oxygenation status of the human kidney before we do a partial nephrectomy, remove part of the kidney for kidney cancer, can give us really interesting information and help us predict what's going to happen after surgery in terms of the patient's kidney function. Specifically, we found that kidneys that were at baseline less oxygenated tended to be at more risk for renal failure or problems with renal function after surgery. And this is an additional tool to help us detect these things. And so that's really useful. Hopefully we'll be able to use this during laparoscopic or robotic partial nephrectomies, ultimately in humans, to tell us what's going on in terms of baseline oxygenation. If we can film what's going on in terms of oxygenation, that gives us important information, we think, and may help us know if we can influence that and change that and help decrease the harm to the kidney that occurs from being starved of oxygen. Today we're going to remove the kidney. We'll be able to take some pictures of the kidney using the HSI to show us the baseline oxygenation, similar to what we hope to do with humans, to tell us what's going on before we do anything to the kidney. And then we'll be coming across the kidney's blood supply with a vascular stapler to remove the kidney, and we'll be able to take some pictures, again with the HSI, to show us the kidney becoming deoxygenated. So that'll be a good demonstration of how this technology works and how it might be useful down the road. Okay, so we're coming in here with the HSI camera using this viewfinder, and you can see the kidney in the distance there, the bowel is in the left lower corner here. And so we're coming in so that we're at a distance that's going to be appropriate to film with the HSI camera, and I've got a good view here. So the kidney is well localized here in the center. And then we're going to go ahead and we're going to take the image with the HSI. Go ahead and let's acquire. Okay, so we're getting a sense of the oxygenation here. You can see sort of the bean-shaped structure there, and in the left lower corner, that redder area is the bowel that appears more oxygenated on its surface. So we're getting some information, and we'll be able to compare this once we clamp off the clamp off the hilum of the kidney with the stapler. We'll be able to see and compare this image that's well oxygenated with that orangey yellow color compared to what we're going to see down the road once the blood supply has been cut off. So right now the kidney has been clamped off for several minutes, and so the oxygen in the tissue is being consumed. And so it's becoming bluer and bluer as time passes, and you can see a very, I think, clear outline of a kidney shape here, as Abhas is pointing out, much bluer than the baseline image, compared to, you can see in the forefront, when we get a better picture here, well, you can see that the bowel is the same as it was before, bright red, because it doesn't have its blood supply cut off.
So I think you can see from what we demonstrated today that this technology has the ability to give you real-time information about what's going on in the kidney and the surface of the kidney and the oxygenation, and that is a potentially great tool both clinically and for research. Right now, we already talked earlier about how we've used this technology to film the kidney. The baseline oxygenation has been linked to risk for renal failure after surgery, removal of a kidney tumor, for example. But what we're looking at in the future is being able to use this technology to try to influence that damage to the kidney that occurs during clamping off the blood supply. Things we've thought of doing are modifying our technique, possibly clamping off the artery only partially to allow a little bit of blood to come through, and so we can film that procedure and see differences using the hyperspectral imaging. Also, we're wondering if there might be a pharmacologic way to modify what's going on in the kidney and mitigate some of the ischemic damage that's being done. So we're also planning to look at the influence of different medications, giving a drug or various types of drugs before surgery, before we clamp off the blood supply, and see if that can affect the process that's going on, the damage that's occurring. And using hyperspectral imaging with this technology, we can see what's going on in real time, and we have something in addition to the blood test that we've historically used to monitor kidney function, and we can get some feedback real time to see the processes that are occurring during the kidneys being clamped.